Hello everyone, welcome to Texture Myth. In this session, we are going to talk about another very important topic related to medical coding anatomy, where we will be focusing on the second type for the third classification, that is encapsulated nerve ending. So in this session, we will be talking about what is sensory receptor, type 2 encapsulated nerve ending. Okay. So by the end of this session, you will be able to understand all the concepts related to it. We will discuss some interview questions, its types, subtypes, everything we are going to cover in this particular session. But before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic. Because for time being, we are just mainly focusing on what is encapsulated nerve ending. But prior to that, we have already covered two types of classification. We have discussed their subtypes, right? So if you know about those things, then it would be much more easier for you to understand the ongoing topic. Okay, and for that you can also refer the Texture Myth digital course book, which is freely available in the description box. There you will find thousands of sessions available in both Hindi as well as English language. So without any language barrier, you can easily consume the content. And in case if you have any queries or question related to that session, feel free to reach out to me through comment section. I would be more than happy to answer all your questions there. Okay. Alright, so let's get started and see what is the encapsulated nerve ending. Okay. So definition wise, it's very simple and straightforward. So encapsulated nerve endings are basically the sensory receptor where the nerve ending is surrounded by connective tissue capsule. Okay, here the nerve ending is surrounded by a connective tissue capsule, giving them a more complex and organized structure compared to free nerve ending. Okay, the capsule around the nerves ending enhance their sensitivity to special types of stimuli and allows them to detect more precise and detailed sensory information. Okay, so it is more sensitive because it has complex structure, and as we already know, like in one of the session we covered, right, that if the structure is complex, it will provide more functionality. Okay, so we can say that those capsule which is surrounded, right, it enhances their sensitivity to specific types of stimuli and allows them to detect more precise and detailed sensory information. Okay. Another thing is encapsulated nerve endings is a sensory receptor with protective connective tissue capsule surrounding the nerve ending, more complex, more specific than free nerve ending. So just one thing, just don't confuse, just one thing, that it's more complex than the first type, which is free nerve ending, and it provides more specific, like it is more specific than the free nerve ending. Clear? Now let's move forward and see what are the types related to that. So there are mainly four types for encapsulated nerve endings. First is Meissner Corpuscles, which is mainly for detecting the light, touch and texture. Second is location, where location wise it is present in fingertips, lips, hairless skin. Second thing is Pacinian Corpuscles, which is to detect the deep pressure and vibration. Location is deep skin, joints and periosteum. Third thing is Merkel's disc, fine touch and sustained pressure, fingertips, lips. Fourth is Ruffini ending, skin stretch and sustained pressure, deep skin, joint corpuscles. Okay, so what we are looking here, we are just focusing on the type, it's what is detects and its location. Okay, now one by one we will talk on these topics in detail. So firstly we will cover Meissner Corpuscles, which is for, like you can see, Meissner corpuscles are encapsulated receptors that detect light, touch and texture on the skin surface. Okay, so it is mainly to detect the light, touch and texture on the skin surface. Location wise, it is present in dermis of hairless glabrous skin, most numerous in fingertips, palm, lips and sole of feet. Most numerous in fingertips, and that is the reason why fingertips are extremely sensitive to the light touch. Clear? Now if we talk about the clinical significance, so loss of Meissner corpuscles function cause reduced sensitivity to the light touch. Okay, so if there is any loss of Meissner corpuscles function, then it reduces the sensitivity to the light touch. Commonly affected in diabetic peripheral neuropathy, patient lose ability to feel light touch in the feet, leading to undetected injuries and ulcers. Okay, so in diabetic peripheral neuropathy, patient mostly lose their ability to feel the touch in the feet. Third thing is important in two discrimination testing, 2-point discrimination testing, ability to distinguish two separate touch point on the skin. So if it is not there, it will cause this issue. Okay, now we will talk about the next thing, that is the Pacinian corpuscles. Okay, so what is Pacinian corpuscles? It is basically the largest encapsulated receptor which detect the deep pressure and vibration. Okay, so it is mainly for detecting the deep pressure and vibration. Location wise, it is found in the dermis and subcutaneous tissue, also found in joint, corpuscles, periosteum of bone and mesentery. Yes, it is visible to the naked eye. They look like a tiny onions due to their layered capsule structure. Okay, and if we talk about their clinical significance, then it's you can see here, Pacinian corpuscles in the periosteum make bone surface very sensitive to pressure. This is why bone fractures cause immediate severe pain. Okay, it causes the severe pain because it is the mainly we have a complex structure, so it is more sensitive. Okay, second thing is loss of vibration sense. Detected by Pacinian corpuscles is tested clinically using tuning fork. Loss of vibration sense is early sign of three things. What? Diabetic peripheral neuropathy, vitamin B12 deficiency, spinal cord dorsal column damage. Okay, so I think this part is clear to everyone. Now we will talk about the third part, that is Merkel disc. So Merkel disc are encapsulated receptor that detect fine touch, sustained pressure and spatial details of the object. So basically we can say that they allow the brain to identify the exact shape, edges and the texture of what is being touched. Clear? Location wise, yes, it is present in the epidermis, most numerous in fingertips and lips, important for reading barrel and one discriminative touch task, fine discriminative touch task. Okay, now we will talk about its clinical significance. So loss of Merkel disc function cause inability to identify object by touch alone. So if Merkel dysfunction is not there, then patient won't be able to detect or identify the object by touching alone, and this is called as osteognosis. Okay, osteognosis. Merkel cells can undergo malignant transformation, becoming Merkel cell carcinoma, a rare but aggressive form of the skin cancer. And then third thing is, it is commonly affected in condition causing peripheral neuropathy. So I think now you have idea of this Merkel disc, and going forward we will talk about the fourth type, that is Ruffini endings. The definition is very simple. Ruffini endings are encapsulated receptor that detect sustained skin stretch, sustained pressure and joint position. They mainly provide the brain with the information about the degree of skin deformation and joint angles. Okay, location wise, again it is also present in the deep dermis of the skin, also find in the joint capsules and ligaments, important for detecting finger position during the gripping. Okay, so at the time of gripping it helps us to detect the finger position. Clinical significance, like Ruffini endings in joint capsules contributes to the proprioception. Here, like you can see, we are using the term proprioception. So I'm sure you know the thing, because we have already discussed this thing in detail, like what is proprioception. Okay, so I'm assuming you know, that's why we are moving forward. Next thing is damage to structures, also damage Ruffini endings, contributing to joint instability and poor proprioception after injury. And the third thing is affected in condition causing joint degeneration, such as osteoarthritis. Clear? So I think this type is also clear to everyone. Now we have discussed 4 types, so it's better to revise the things properly. So for that, there is a memory tip, so you can refer this thing. Like encapsulated means enclosed in capsule, more complex, more specific. Okay, just learn this thing. The capsule makes these receptors more sensitive and specific compared to the bare free nerve ending. The 4 types are mainly the Meissner, which is mild touch. You can remember it with M. Okay, Meissner, M is mild touch, mild light touch. P Pacinian, pressure deepen vibration. M Merkel, minute fine detail. R Ruffini, rubbing and stretch. Clear? Similarly, if you want to learn their clinical association, so you can say that Meissner is light touch loss, diabetic neuropathy feet. Pacinian, vibration loss, tuning fork test. Merkel, fine touch loss, osteognosis, and Merkel cell carcinoma. Ruffini, joint stretch and joint instability after the injury. Clear? So yeah, I think we are good for now, and there's one question for all of you, and today's question is very tricky. What is the most widely distributed sensory receptor? Please do share your knowledge in the comment section, because when you share your knowledge, it helps others. If someone don't know the answer of this question, they can simply share. They can simply look at your answers and understand from there. Also, when you are commenting these answers in the comment section, it provides me the notification and gives me the idea that you guys are referring this series, and on the basis of that only, I will release more new sessions to it for this playlist. Clear? So yeah, that's all for today. See you in the next session with new topics. So thank you for watching TechSharmat.